Good afternoon and welcome to the second of a three-part webinar series to launch the Institute of Policy Studies annual flagship report, Sri Lanka State of the Economy 2021. This year's report focuses on the theme of pandemics and policy, protecting health and promoting economic recovery. The first webinar was held on Monday, which discussed policy choices and trade-offs facing Sri Lanka, focusing on the country's macroeconomic outlook, trade, and competitiveness. Today's webinar will discuss COVID-19 related socio-economic impacts on Sri Lanka's labor market, as well as the education, health, and migration sectors under the sub-theme Pandemics and Disruptions, Safeguarding Lives and Livelihoods of Sri Lankans. The third webinar is scheduled for tomorrow at 3 p.m. and will discuss Sri Lanka's social protection and food security needs in facilitating an equitable recovery from the pandemic. Registration details for this are available on our website, www.ips.lk. There is a short video which sets the background to today's discussion, and we would like to share it with you now.
Sri Lanka entered the COVID-19 crisis with high informality in the labour market and inequities in access to health and education. Well over a third of Sri Lankan workers are in high-risk industries which are more susceptible to economic risk from the crisis, such as accommodation and food services. Not surprisingly then, Sri Lanka has seen reduced employment levels, with workers shifting to more vulnerable employment types, such as self-employment, since the onset of the pandemic. Youth were affected more severely by the slowdown. Unemployment grew by 4.5% for 15 to 24-year-olds and by 2% for 24 to 29-year-olds. Moreover, existing gender inequalities have made women more vulnerable to the economic impacts of COVID-19. Loss of employment has impacted women more, accompanied by a sharp rise in economically inactive women, further worsening Sri Lanka's already low female labour force participation rate. Migrant workers have also been impacted, adding to the labour market disruptions. Waves of returnees prompted by exposure to the virus and income loss face further hardships from social exclusion and reintegration challenges. While COVID-19's impact on remittance flows has remained positive for Sri Lanka, it is still too early to determine whether those effects are merely temporary. For better preparedness in the future, public spending on education and health has to be maintained at a higher level. COVID-19 has highlighted the potential for an education equity crisis. Inequities in accessing digital learning and difficulties in adapting to the new learning environment are widespread. Public spending as an investment in education to mitigate the detrimental impacts is essential. With 75% of COVID-19 related deaths in Sri Lanka linked to those suffering from non-communicable diseases, the importance of robust health systems to deal with multiple challenges simultaneously is clear. The pandemic also highlights the need for regulatory oversight on traditional healthcare therapies to ensure patient safety. As COVID-19 demonstrated, they have an important role subject to proper clinical trials, data, and other protocols. For detailed insights, read IPS's Sri Lanka State of the Economy 2021 report. Focused on the theme of pandemics and policy, protecting health and promoting economic recovery, the report examines some of the key socio-economic issues and policy choices facing Sri Lanka today.
Before we begin, there are a few housekeeping items that I would like to bring to your attention. Today's webinar is scheduled to last 1 hour, including the question and answer session. This webinar is being recorded and it's live streamed on our Facebook and YouTube pages. And the recording will be made available on our YouTube channel once the event concludes. The media has been invited to cover the event. Questions can be sent via the Q&A box during the question and answer session, and we will try to accommodate as many as possible. You can also follow IPS on Twitter using the handle @TalkEconomicsSL and use hashtag SOE2021 for live updates. We will begin today's webinar with 2 presentations from IPS researchers, followed by comments and reflections from 2 external commentators. The floor will then be open for questions from the audience. Without further ado, I would like to invite our first panelist and speaker for today, Dr. Nisha Arunatilake Director of Research at IPS and Head of Health, Education and Policy Research. Over to you, Dr. Nisha.
Thank you, Ashani. Just let me get my... Okay. Okay, thank you. So today I will be talking about, sorry, this thing is not working. Okay. I'll be talking about the labor market and education impact of the pandemic and the policy responses and how they can be improved for in preparedness for future disasters. Let me start with the labor market. We can see globally labor markets were affected because of the pandemic. ILO estimates that some 225 million jobs were lost during 2020. Sri Lanka too lost 150,000 jobs because of the pandemic. Moreover, the quality of available jobs deteriorated because of the pandemic. As you can see in the figure, unemployment rate in 2020 increased by 0.7%. And the unemployment was youth and low and middle skills workers were affected more by this. Also, we see that the quality of jobs in the market deteriorated. So the more protected and higher paying jobs in services and industry sector decreased, while jobs in agriculture, which are characterized by low social security and lower earnings, increased. And also own account workers increased, who are also not receiving much social security or earnings. If we look across different occupation groups, we all know that the frontline workers were affected and most vulnerable because of the pandemic. And these include health professionals, nurses, doctors, and personal care workers and security guards. As you can see in this graph, a lot of the frontline workers, especially in the health sector, were females. In the security guards and so forth were mostly males. The pandemic didn't affect all the industries equally. So ILO categorizes industries according to the economic output risk from the pandemic. So high risk industries include industries such as accommodation and retail, while low risk industries include industries such as education. In Sri Lanka, 39% of the workers were in high risk industries. If you look across different population groups, we can see the risk from the economic output risk from the pandemic varies across these groups because they self-select into different industries. As you can see again, the low and middle skilled workers are more affected by the pandemic in terms of economic output risk, and females are also more affected. So the government came up with various measures to help the workers to provide relief. Cash transfers were given to most affected and some self-employed. And also there were schemes to retain jobs in terms of allowing employers to pay pro rata basis. And also concessions were made in terms of statutory payments. But if you look at the relief package given to workers and firms in Sri Lanka, it is not as big as the types of relief provided by other countries. Sri Lanka recently, IPS conducted a survey to get the perception from employers, employees, trade unions, and government officials on the relief provided by the government. And something that came out from this survey is that the employers and the trade unions and employees also all felt that government could have provided more relief using existing social security funds. And if you look at other countries, we see countries like India and Malaysia also use existing funds to provide more security to their workers. So going forward, how to improve policy responses in future. One thing that we see is that there is an urgent need to improve the coverage of social security. If you look at the social security system in Sri Lanka, most of the social security is available post-retirement. But this COVID-19 has highlighted the importance of providing pre-retirement social protection in terms of unemployment benefits and also wage support during illnesses. So if you look at, again, countries like Nepal, Malaysia, Singapore, they have funds, separate funds to provide pre-retirement social security. So this is an area where Sri Lanka has to improve if we are to have faster recovery from these type of disasters in future. So Sri Lanka resorted to work from home policies during the pandemic, but the capability to work from home really differs across different types of workers and also firms. So there is an urgent need to provide training and also digital access to firms and workers, so you can benefit more from this work from home policies. And lastly, in terms of the labor market, I think there is an urgent need to improve the labor market institutions and information on the labor market, so we can provide more targeted benefits to the workers. So the effectiveness of limited resources, financial resources available are maximized. If I am to move on to education, like with the labor market, the education sector was also much affected by the pandemic. So in Sri Lanka also, since March 2020, schools were closed other than for a few brief periods when they were in operation. As you can see in the figure, the share of total school days missed are significantly higher in Sri Lanka compared to other countries, the averages of the other countries. So this is a concern. So because the schools were closed, the Education Ministry had the policy of online education, and also the ministry got together with the National Institute of Education and some private sector organizations like the Dialogue Foundation, and then provided lessons via TV. But still, we see less than 50% of the students were reached via online, and in the smaller schools, only 30% were reached via both online and from this education through other types of media like TV. So in this second year of pandemic, a lot of the countries are moving from emergency responses to recovery. So what needs to be done in terms of recovery? We need to assess the learning losses, because a lot of the schools, as I showed earlier, a lot of the children didn't have access to lessons. So there needs to be an assessment done about the learning losses and adjust the curricula so that the education careers of the students can move on, focusing on the most needed competencies. And there is also a need to provide capacity building for teachers and also schools, because schools have to organize these lessons to deliver education through blended methods so that you can cover the gaps of the learning losses. So going forward into the future, there needs to be better mechanisms for monitoring the impact of school closures on education outcomes. And also we need to, Sri Lanka is actually fortunate to have a network of schools and institutions that we can capitalize on, and to provide more decentralized solutions to school closures, because we see that the pandemic didn't affect all the areas equally, and the ability of different schools to provide education through online or using TV is different. So more decentralized solutions would have actually improved the education outcomes of the children despite of the pandemic. And also there's a need to invest in technology so that we can leverage on the experience from the pandemic to take it forward to fill gaps in improving the quality of education for schools in rural areas. And very importantly, we need to have stronger leadership in the education sector so that in future disasters, strategic decisions can be made to provide solutions so that we don't lose much from disasters. I will stop here. Thank you.
Thank you, Dr. Nisha, for that very informative and interesting presentation. I would now like to invite Dr. Bilesha Weeraratne, Research Fellow and Head of the Migration and Urbanization Policy Research at IPS. Over to you, Dr. Bilesha.
Thank you, Ashani. Let me share my screen. While I get on with it, do you see my screen, Ashani? Yes? Okay. Just like the previous speaker mentioned, that there were implications for workers in Sri Lanka. Sri Lankan workers abroad also had implications during the pandemic. So in this session, I will be talking about how migrant workers cope with the pandemic and touch on certain aspects of the health sector in Sri Lanka in terms of migrant workers' experience. As we all know, labor migration is an important component of the Sri Lankan economy, and annually we send about 225,000 migrant workers abroad, and in return we receive on average about $7 billion as remittances. And considering the current situation of the economy with foreign exchange concerns, we know how important these remittances are to our economy. So during the last 2 decades, on average, remittances have accounted for about 8% of the GDP or 80% of the external trade deficit. But when the pandemic hit in 2020, departures were drastically decreased and only about 53,000 migrant workers left Sri Lanka. Also, many migrant workers overseas had to return Sri Lanka also. Yet, defying many predictions, remittances to Sri Lanka did not suffer in 2020, but as we see in this screen, in 2021, we have seen, as shown in this red line, we have seen the decline in remittances on a monthly basis. So while we know a lot about remittances and the migrant stock going abroad, we know very little about how migrant workers coped during the pandemic. So in this session, I want to focus on some of those aspects. So by early 2021, there were over 128,000 Sri Lankans wanting to come to Sri Lanka, but due to the closure of the borders and non-operation of commercial air flights into Sri Lanka, only about 47% migrants were able to be repatriated. So in terms of migrant workers, after making the decision to come to Sri Lanka, they had to stay in the country of destination for over 4 months until this repatriation was sorted out for them. And then some of these migrants were laid off, and majority of them, they go with the intention of working for about 2.5 years. We found out in our survey that many had to come back much earlier than they planned. So this would affect their earnings and their capacity to come back during the pandemic, because there were a lot of costs involved in this return process. After there were returnee paying model introduced into this repatriation or returning, there were heavy fares for return air tickets, and the quarantine facilities were also charged at quite expensive when compared to the monthly wages or the remittance capacity of these migrant workers. So when we look at this chart over here, we will see that majority of the returnees were either self-financed or their employer paid for their return air ticket. And only very few, as you can see here, were supported by the Sri Lankan government or the government in the country of destination. So this shows that returnees were a self-selected group, and the loopholes or the limitations in Sri Lanka's return and repatriation efforts were not able to bring a wide cross-section of returnees back to Sri Lanka from the onset itself. Later on, they picked up. Mind you, this is in the context of Sri Lanka having a return and reintegration sub-policy and being one of the only countries in the region to have this sub-policy. But the issue was, despite having a sub-policy, it was not implemented. So there was no base level reintegration mechanisms existing before the pandemic, which made it very difficult for return and reintegration to happen during the pandemic. So as a result, some of these migrants had to spend their savings at the destination until repatriation was sorted, or after they came back due to reintegration issues, again, they had to survive on their savings. So ideally, for returning migrant workers, there has to be reintegration support along 3 dimensions. That's economic support to maybe find an employment opportunity, and social aspects to reintegrate with their community or family, as well as psychosocial to handle the emotional stress that they might have during a return of this nature, especially. However, despite having identified these aspects in the sub-policy also, what happened in Sri Lanka was that majority of the reintegration support focused on testing, quarantine, and treatment measures. This is largely because consistent with the overall health sector approach in Sri Lanka of the 3T strategy, where testing, tracing, and treatment was done. So returnees who were tested positive will be sent for treatment. If they were negative, they had to undergo a quarantine period. And initially, the entire testing, quarantine, treatment was financed by the government, but later on, for migrant workers, they had the option of paying on their own, as I said before. So this testing and treating was handled by the health sector of Sri Lanka, which comprises of a Western medical sector and a traditional medical sector. Now, due to cultural and historical aspects and availability and accessibility, there is a high affinity of Sri Lankan population to resort to traditional medicine. As you can see in this chart also, there's a huge component of Ayurvedic doctors in Sri Lanka. But absence of a properly regulated traditional medicine sector, and we saw during the pandemic also how some of these products were released to the market without proper regulation, without proper rigorous clinical trials, and there was limited integration between the traditional and the Western medicine sectors. It was also evident because the traditional medical facilities were used as intermediate care centers only very late in the pandemic. So overall, Western medicine was the main approach in terms of handling the pandemic in Sri Lanka. So I want to touch on a specific area that affected majority of Sri Lankans as well as migrant workers, that is the vaccination process. So all of us know there were a lot of issues in terms of the vaccination process in Sri Lanka. There were difficulties in acquiring vaccines on a timely manner. There was irregular and inconsistent supply. We know the first doses came and there was a huge lag in the second dose. And then also there were regulatory delays in terms of providing approval for these vaccines, as well as this disorganized deployment of the vaccination process. We saw that there were no method of appointments. There were huge queues and the queues were throbbing with people. And also there was no systematic manner in deploying or introducing the vaccine to various age groups. So these sort of issues in the overall vaccination drive in the country also had ripple effects on migrant workers. As a result, vaccinating migrant workers started very late in the process, as late as July 2021. But however, I should say that the vaccination process for migrant workers was much better organized than the overall vaccination process in the country. Because it was, there was a process where potential migrant workers had to send an SMS to the Sri Lanka Bureau of Foreign Employment, then an appointment was sent and the places were properly sorted and organized, and it happened very in a methodical manner. However, there were concerns, or there were like allegations saying that coupling the vaccination for potential migrant workers with the registration fee of 16,000 plus of the SLBA fee was unethical. So we can discuss about that at the Q&A if we have time. Additionally, there were other issues that could have been addressed in the vaccination drive for migrant workers also. So now, specifically, we know there were various types of vaccinations that were brought into Sri Lanka. But however, countries of destination have their various requirements in terms of vaccinations. So, for instance, countries like Saudi Arabia or Kuwait, they do not accept the Sinopharm vaccine, which was widely inoculated in Sri Lanka. So when I visited these vaccination centers and spoke to some of these potential migrant workers, I saw that some of these potential migrant workers are trying to determine what vaccination is needed by speaking to the other people in the line. Like they're saying, okay, I'm going to Italy, should I take Moderna or Pfizer? So there was a huge lack in information dissemination for these potential migrant workers. And then also the vaccination process, after the vaccination process, you need to have a vaccination card, a digital vaccination card for most of these migrant workers. But accessing this digital vaccination card for an average migrant worker is not easy. And on top of it, so if the vaccination card mentions the vaccine as Covishield as opposed to AstraZeneca, there will be added complications for these migrant workers to reach these countries of destination. So finally, picking up these two areas of health and migrant workers, I just want to bring out a few areas that we can focus in the future. One is mainly to integrate the traditional and the Western medical sectors in Sri Lanka and handle this pandemic, because there are various practices in the traditional sector that has been widely used and is expected to be fruitful, like inhalation and these herbal ingredients that people widely use. However, there has to be clear regulation and proper information on clinical trials and information of their efficacy. And also, we saw that some incipient trends of local production of pharmaceutical products or equipment. So these things also can be boosted, because importing such items in this current foreign exchange crisis is not all that conducive or easy. Another area to focus on is adopting a robust laboratory strategy, which allows to test for new mutants of the virus also. Also, digital care resources have to be expanded. When we come to migrant workers, some of the areas to focus on is to improve the base level of reintegration support, because the absence of reintegration experience before the pandemic was a huge deterrent in providing reintegration support during the pandemic or during a crisis event. And also, as mentioned in the sub-policy on return and reintegration, it's important to develop a pragmatic contingency plan for return and reintegration support. And finally, we all know the implications of the difficulty of having credit, foreign exchange in the country and the issues related. So it is paramount that we send all our potential migrant workers with job orders to countries of destination. So to do that, we have to give them proper information about the vaccination requirements of these countries of destination or the travel requirements, and also educate them on safe travel, employment, and living during the pandemic overseas. So hopefully we will have more migrant workers leaving the country in the coming months. That's all. Thank you, Ashani. Over to you.
Thank you very much, Dr. Bilesha, for that very interesting presentation. I would like to remind the audience that if you have any questions, you can type them into the Q&A box, which we could take up during the Q&A session. We will now move to our first external commentator, Ms. Madhavie Gunawardena, a director at the Telecommunications Regulatory Commission of Sri Lanka and formerly Commissioner at the Department of Labour. Ms. Madhavie, over to you. Provide some comments and reflections.
Thank you very much, Ashani. And first of all, I would like to thank the IPS fraternity for inviting me for this important discussion. At the same time, I would like to also state that the views I'm going to express would not essentially be the views of my former employer or my current employer. So bearing that in mind as well, listening to Dr. Nisha and Dr. Bilesha, we do again see the requirement of Sri Lanka to revisit and our regulations regarding which surrounds the workplaces, because we are now forced into the acceptance of the working from home situation, which we will have to now look at. And at the same time, so the accommodating this flexibility in our workforces, in our labor legislation and other legislation governing the workplaces is essential. And personally, listening to all of you, I think this is in a way, a golden opportunity for the labor regulation of the country, because now we are sort of forced to doing this as well. And at the same time, I remember early April 2020, where we were thinking, okay, what is going to happen to the female employment rates in the country? Because anyway, we were stagnating around 30%, 33% like that for almost the past decade. And suddenly the females of this country are burdened with looking after their children at home, no schooling, still no schooling, and ensuring that their education needs are met. You are either working from home or you are working in office. So this imbalance between the family responsibilities, career responsibilities, and your career aspirations sort of pushes the women of this country towards a certain extent where you, in certain cases, have to take certain decisions. And as Dr. Nisha said, my last points, for the past 1 year, we have almost had no schooling. We have been having schooling online. And being a country with a significantly high percentage of NEET population who are not in education, training, or employment for the youth. And this gap, where the 15-year-olds, 16-year-olds, even the A-level students who did not really have any opportunity to practice their social skills. They did not have their sports meets, they did not have their debating, they did not have their usual interacting within the peers. So in the future, I see this implication because we're going to see a cohort, not only in the schools system, even in the universities, though we have been pushing them and progressing them through the education system to the next grade, they definitely had very less opportunity to enhance their employability skills. And being a country which has been sort of highlighted for this lack of employability skills, the social skills, we are at a risk which we will need to address. So forums like this, where we tell the requirement, where we say, okay, this is needed, will help that the policymakers, academics, everyone to look into this requirement and then to proceed. So overall, I think the future skill gaps and the increasing in the employment of the females, we will have to look at. We do have a huge unemployment problem, and with huge supply of labor, we may have to revisit the labor exploitation, low wages, unemployment, all this we will have to now look at. So that is it on my side for now. Thank you.
Thank you very much, Ms. Gunawardena. I now invite Dr. Kolitha Wickramage, Global Health Research and Epidemiology Coordinator at the International Organization for Migration, to share some thoughts and reflections with us.
Thank you very much, Ashani, and thank you once again, IPS, for inviting me for the panel. My views, of course, are not aligned with IOM by any means. These are my personal views. But first of all, I'd like to congratulate IPS for putting together this report. And I think also to devote chapters specifically on migrant workers and the health implications. My focus of my feedback is, of course, on the two presenters, but also more specifically on Chapter 8 on COVID-19 and reintegration challenges, to which Dr. Bilesha discussed, and also Chapter 12 on coping with pandemics. First of all, the chapters are well written, but most importantly, I love the fact that there was a rigorous research agenda that accompanied your policy and practice recommendations. I think we see a lot of opinion-based and not evidence-based policy formulary and recommendations. So well done. And for example, in chapter in chapter 8 on reintegration, this was based on not just qualitative interviews with migrant workers, but also on a survey and also secondary data analysis from SLVFE. Now, I must say there were some interesting insights that I want to highlight and reflect on. Already we saw these gender dimensions to which Madhavie just discussed, gender dimensions of the returnees. So with an overwhelmingly majority being male, 74%, but this also could be due to multiple reasons, not just the high proportion of male migrants, as we've seen the shifting the feminization of Sri Lanka's labor force, but also because of the issues, as Bilesha discussed, inhibitive airfare and quarantine associated costs that made a self-selection towards the more richer Sri Lankan migrant categories, and therefore the skilled workers that are taking up the reintegration package. But also the report indicated that many female migrants, as they were, the valence on female labor migration is mainly within the caregiving and domestic work, that and the report mentions this places them more in a secure financial, in terms of secure job security position, and therefore less likely to become redundant even amongst pandemic conditions. This is very, I think, an important aspect of the gendered approach of the returnees that I think we need to explore further. The IPS survey also found that the returnees, where they were located, is also an important practical policy consideration. For example, in terms of skills, Puttalam district required more skills and semi-skills job opportunities compared to other districts which required the skilled and semi-skilled jobs. So really interesting data that is very contextual, hyper-focused, that policymakers at national and subnational level can really pick up and start to practice with. I think the qualitative data emerging from that report, from the study, really struck a chord, because this is some of the work that we've been really emphasizing as the UN Migration Agency, and that is the vast amount of energy, even within the research sphere, looking at remittance-related research, but less on what are the health implications of Sri Lanka's labor migration workforce. So what are the real health and social consequences? What are the health impacts, health status? So we embarked on a series of studies way back in 2013, 2014, and it's interesting that the study that was done as part of this report also highlighted the importance of psychosocial and mental health as a critical need for the reintegration package. So not just the financial component, but ensuring this component is absolutely crucial. And it came from the voices of the migrant workers themselves. And I think this is still an unmet agenda, where we say migration in health and health in migration. I think the seat of health in the migration governance sector and the seat of health in the migration governance sector hasn't really happened. And I think this still continues to be a challenge. And I think this and I think one of the key findings of this particular research is that there needs to be this dialogue. And of course, there's some very specific recommendations and policy options that the report highlights. But just pivoting very quickly, though, to the chapter on the pandemic itself. And again, because of time, I'll just highlight something that maybe reflect on something Bilesha concluded with, and that is on the vaccination strategy. Yes, Sri Lanka has indeed made remarkable progress in terms of the coverage rates and what we're seeing in terms of the eligible vaccine population. However, one can also argue the number of deaths averted, or the number of serious cases that could have been averted if indeed a more systematic strategy, such as those provided by WHO SAGE recommendations, were followed. For example, SAGE clearly stipulates the prioritization amongst elderly and those with comorbidities. But in reality, in Sri Lanka, what we had was a bell curve. There was different splotches, a mishmash of varied vaccination rollouts. And this indeed caused some sites to have an abundance of young people vaccinated far earlier than the elderly or those with comorbidities. And I think this is one of the recurring challenges. Look, I'll stop there. I think I've extended my time, but I'm happy to dive further in the Q&A. Thank you.
Thank you very much, Dr. Wickramage. Now we can move to the question and answer session. As mentioned earlier, please, you can send in your questions using the Q&A box. So to begin with, there are two questions for Dr. Nisha. Both are interrelated, so I'll ask them both together. One is about the impact and safety nets for informal sector workers who are not included in EPF or ETF. And the other question is, this person mentions that you made an interesting point that social protection schemes like EPF and ETF should have been used better to provide relief to work. Any idea on how this could have been done?
Thank you, Ashani. So with regard to the informal sector, government did provide that ₹5,000 cash transfers for some workers in the informal sector. But the size of the sector and the size of the package and the frequency in which it was given was not at all adequate. This is partly because of the problem of the fiscal constraints the government is having. So what the other countries are usually doing in terms of the informal sector workers is they have active government programs like investing in infrastructure and getting local people, recruiting workers locally, so that there are some jobs are created for workers. But even to do that, you need to have some kind of support. Now, government did use some of the available funds. If you remember in the last budget, they reallocated some project funds to generate jobs for people in terms of repairing roads and all of that. But I think a better way of providing relief to workers would be having a separate fund for providing social security. So even when when the government is going through some fiscal constraints, there is a ready source of funds. So to go to the second question, so what the other countries are doing is they have different funds to provide social security for different types of benefits. For example, in Sri Lanka, a lot of the social security is concentrated on post-retirement. It is only available after retirement. But in other countries, you have unemployment insurance and then wage support during sicknesses, also support during these kind of disasters that we are going through. So I think what we can do is we can have a separate fund for these type of pre-retirement social security benefits. And actually recently IPS did a study, Ashani, you were also involved in this study, where we found that actually the amounts that are allocated for ETF, not EPF, ETF, the Employees Trust Fund, is sufficient to cover these pre-retirement benefits that can be given to workers. Thank you.
Thank you, Dr. Nisha. I would now like to ask a few questions from Dr. Bilesha. One point, Dr. Bilesha, you mentioned was that there was an increase in remittances in 2020. And this is in contrast to many other macroeconomic fundamentals which actually went down during the pandemic. So how can you explain this increase in remittances? What are the factors that led to this?
Ashani, there were several reasons behind this increase during 2020. One was that remittances are very counter-cyclical. So when there was a downturn in the Sri Lankan economy, the migrant workers overseas, not only migrant workers, the diaspora also, would have sent more remittances to Sri Lanka. That is one reason. Another is the possibility of this regular remittance channels were the only operating channels, and these informal channels where migrant workers or the other Sri Lankan origin people would have resorted to sending money before the pandemic would not have been operational because of the lockdown situations in the countries of destination. So because of that, these informal remittances would have been diverted to the formal sector during the pandemic. So therefore, the reported formal remittances would have gone up. So that would have contributed also. And then there was this possibility of backed up remittances, catching up during the open, when the lockdowns were released. That means like around July, August, June, July, August, the increase would have been these backed up remittances. And also another important point is that there were many people laid off, and some of these laid off people would have had savings or their terminal benefits that they have received. So they would have remitted all of these before coming to Sri Lanka. Normally, that sort of terminal benefits would have been distributed across so many months or so many years. But this time, there were so many people laid off all at once, and all of them were trying to come to Sri Lanka. So before coming, normally they would bring their money, or because they can't hand carry it, unlike the normal times, they would have remitted. Also, touching on the hand carrying aspect, normally people can bring up to 10,000 US dollars in hand. But now, during the pandemic, migrant workers or Sri Lankans returning had to go straight into a quarantine center for 2 weeks. So nobody wanted to have a large sum of money with them in this sort of a setting. So because of that also, they limited hand carrying, and that also came as formal remittances under the recorded channels. So those would have been the reasons that contributed to the increase in 2020.
Thank you, Dr. Bilesha. Ms. Madhavie Gunawardena, I have a question for you. You mentioned the crucial need to revisit many of our labor laws to accommodate the newfound flexibility in work, and also to address the plight faced by female workers, and also to address future skills gaps in the context of a high need rate in the country. So these are like so many areas to focus on. How, if we were to prioritize, what would you suggest that we can do first? Like which area can we address, and how can we address it? Like what specific changes are needed in our labor laws to do this?
Okay, that the question itself is a tough one to deal with, but I think the first things we can do easily would be to look at the working conditions. But for this, both the employer, like all of us know that the labor regulation in Sri Lanka is not just done by the labor department or no the government. It is a tripartite effort. So it is not just the government, it's the employer comes in, employers federation, and all these other employer representatives. And then we have the employee representatives, the trade unions and everyone. So this is a huge discourse. And we did have a very successful conclusion. An example of this in early May 2020, where all the tripartite constituents got together under the leadership of the Honorable Minister and decided on the ways of compensating the employees who had to be kept home without work. So that went up to a cabinet decision itself, and then we took that decision and implemented. So this decision was taken in agreement of everyone. So it is not that we cannot, we can, but then we need to recognizing that, okay, we are not going to win the whole thing, that we will have to sacrifice certain areas, certain of our requests will not be met. So this tripartite discussion has to go on regarding the labor law revisions. So flexibility, including into the labor law, has been discussed for a very long time. So that can be the top priority. And I'm sorry, I cannot keep back the skill requirement, because that along as the labor sector looks at this, I'm sure the skill sector and all of us can look at the skill requirement, the future skill requirement, and identify the most important. Nisha was talking about identifying the key components, the most important things that a child or a student should acquire. So that will also have to do, because all of us are eagerly looking at coming out of this situation. And for that, all our population will have to work fast and do our contribution. But to make that contribution happen, we have to make sure that our the future entrants to the labor force are equipped with the adequate skills. So yes, that will have to be the strategy. Thank you.
Thank you, Ms. Gunawardena. Moving on to Dr. Wickramage. You were talking about several health sector challenges that both Sri Lankan migrants as well as the overall Sri Lankan population faced during the pandemic. So what do you think are some key lessons that the health sector has learned from the pandemic? For example, some key interventions that serve to mitigate and those that actually worsened transmission, and also how the health system responded to ensuring continuity of healthcare and ensuring critical disease prevention and control, like other disease control during the pandemic.
Thanks, Ashani. Multiple layers of that question. I think, look, what the pandemic has really forced us all to do at a personal level, as a family level, as a organization and community, is to innovate. And of course, it's easy to sit on a panel like this and talk a wish list of how innovative one should do and how our Sri Lanka's health system should have a telemedicine at every point of primary healthcare. But I think one key lesson that we can take from the health sector and the private health sector in Sri Lanka is the flexible and nimble ability to deliver e-health consultations, telemedicine, in terms of delivery of drugs for those with chronic diseases, people with diabetes, cardiovascular disease. I think that's certainly something that we can certainly move towards as a big lesson learned. And the report is very clear on these, and it speaks ad nauseum on exactly what needs to happen at what point. And to a point that Dr. Bilesha made earlier as well, the need for a laboratory information management system, an integrated mechanism where we pool data for contact tracing, testing, treatment, and control. I mean, absolutely critical. So there are certainly things that we can do in terms of digitization of the healthcare sector, but also your question of the importance of continuity of care. I mean, I think with the focus very much on the pandemic, we often neglect the patient who requires his or her a regimen of TB drugs, looking at mitigation measures for dengue, looking at leptospirosis, which actually increased during the pandemic. So it's very important as a public health strategy to have, you don't repurpose or reorient your entire health sector into one particular pandemic. And this is something that, again, highlighted in the report and what needs to be said. I think in terms of things that are not in the report that I'd like to highlight that we can certainly learn from, and that is the concept of One Health, which many listeners might not be aware of. And it's the concept of human, animal, and environmental health. This is One Health concept. And zoonosis or transmission from animal to human, this concept of One Health is poorly studied, poorly explored. I mean, there was a fabulous quote by a pediatrician who mentioned that our region has enormous amounts of capacity in terms of maternal and child healthcare, but yet, and this is his quote by Dr. Zulfia Bhutta, he says, COVID-19 has exposed glaring gaps in public health preparedness in Asia, in South Asia, for a region that has sent rockets to Mars and also have 2 nuclear powers. We don't have a single academic center with the epidemiological experience and expertise to rapidly map and assess a pandemic in real time. And this has proved a major limitation to evidence-based practice. So, there is an enormous opportunity for governments, academia, donors to come together to also build these type of centers. And I think one of the critical things is also local manufacturing of pharmaceutical products, and also the healthcare financing. And I think that, this idea that, the necessity to increase healthcare spending in Sri Lanka in the context of the current financial constraints, where health is seen as an investment and not seen just as an expenditure item. I think, in order to respond to the next zoonosis or the next pandemic, we really need to learn and unlearn some of these lessons. Thanks.
Thank you very much. Dr. Bilesha, there is a question for you regarding the situation in the Middle East. They said that the situation in the Middle East improved in terms of seeking jobs, etc. Has the number migrating for work resumed at pre-pandemic levels?
Sorry, I didn't catch
Yeah, sorry.
the last bit. So has the numbers resumed?
The pre-pandemic levels.
Is that what you're asking? Has the numbers risen?
Yeah, they,
No, not
I'm
yet.
asking whether the situation
I don't
has
think
improved.
that
Okay, yeah.
situation has improved a little bit because now Sri Lankan potential migrant workers are vaccinated, and those who have job orders can seek, but I don't think it has reached the pre-pandemic levels yet. Hopefully in a couple of months, perhaps towards the end of the year or early next year, there'll be more improvement.
Right, thank you. And also you mentioned a sub-policy on return and reintegration, which was not implemented. What were the specific reasons for this?
You're asking me a tough question. I think there are various policies in Sri Lanka which are not fully implemented. So this is one of those policies. Let me put it as it.
Okay, thank you. Dr. Nisha, I have an education question for you. You highlighted several challenges facing the education sector in the context of schools being closed for over 1.5 years. How do you think disaster response can be improved in the future to face future similar crises, and especially to ensure that the education response is more equitable? What can we do?
Yeah, so thank you, Ashani. As I also mentioned in the presentation, I think we are at an advantage because we have a really good network of schools which are organized into divisions, and the divisions are organized into zones, and we have provincial level education departments and ministries, and then we have the center. So we need to improve capacity of all these layers of education institutions so that they can collect information about access to education for children and the problems that they are having in terms of online education and other difficulties that they are having, and then use that information to make strategic divisions and solutions that are appropriate at small geographical levels, because as you know, COVID-19 also didn't affect everybody equally. It was more severe in the Western province for the longest time, almost up till this year. So a lot of the schools in other areas, I think they were open for a longer period, but they could have been open longer. And also the solutions that the ministry came up with, online education and education through television, I think those needs to be integrated, because the teacher in smaller schools, especially the principals and the teachers, they don't have an idea about combining these different types of education provision to provide the best education for the students. So for example, if the teacher knew that lesson 1 is broadcasted at a particular time on TV, they need to have a way of informing the children, okay, children, we are not going to cover lesson 1, watch the TV program to cover lesson 1, and we will just come together to discuss. So something like that. So, but these kind of things is difficult for the teachers to come up with. You know, those kind of instructions could have brought together these different ways of providing education to give children a more full, more interactive education delivery and reduce inequalities. I think going forward, it is very important to strengthen the capacity of these different layers of education officers so that they can react better.
Thank you, Dr. Nisha. There's another question on labor markets, which I will perhaps direct to Ms. Madhavie. What does the panel think about minimum retirement age for private sector employees bill? What sort of impact will it have on future employment and retirement planning?
Okay, so I will start off from where Dr. Nisha stopped first. Now, when Dr. Nisha was doing her presentation as well, it was told that the social security we have at the moment is for the more or less the retirement. So this retirement age actually comes with this Employee Provident Fund Act and the retirement related benefits. It's not that we have a a 70-year-old able person can work. There's no limitation. So this notion of, okay, we are going to increase the retirement age is not universal for the whole country. Yes, we do have a retirement age for the public sector. We do have a sort of a retirement age or like a bar for the private sector as well, but there's no limit for us to go beyond that. It comes in with the provisions of the social security. And at the same time, in the current context, where the employees who are at an advantage with the skills, them staying in the labor market would, yes, definitely benefit the labor force of the country, where we really need to work out. But at the same time, us continuing to be in the labor market, in employment rather, in a situation where employment creation is not really at the levels that we are expecting to be, unemployment rising, then we will have to definitely look at a balance where
I think we lost you for a minute. Yeah.
Yes, I'm sorry. So basically, so that is something we have to look at. It's not that retirement age has to be revisited or anything. Yes, there is a discussion going on and work happening, which I will opt not to comment on since I'm not in the department anymore. But I don't think that is some much larger issues to address at the moment. Thank you.
Thank you. There's another education-related question, which I will ask Dr. Nisha. Any insight about the impact of the teachers' trade union action for such a long time and how the government should respond?
So that's actually very unfortunate. On top of the pandemic, this trade union action preventing children from getting their education. And that has also delayed the national level exams. So, I mean, these will have a large effect on the impact, the education careers of the students. So I think it is really crucial that the government come to an amicable solution to this problem at this time. But I think it is also important because these are also recurring problems. They happen because, of piecemeal solutions to problems. So I think also it is important to avoid these kind of trade union action in future. And whenever there are salary increases and so on and so forth, you have to look across all the sectors and within sectors and make sure that the increases are fair, because it's not only the education sector, even the health sector, we see that and also in the universities, from time to time, there are trade union action to increase salary. So this needs to be avoided. And then we will hopefully not have these problems at times like this.
Thank you, Dr. Nisha. Dr. Bilesha, one last question for you. You mentioned some ethical issues involved in the vaccination process for migrants, which you said we could take up during the discussion. Would you like to share any more thoughts and information on this?
Yes, what happened was potential migrant workers were asked to register with the Sri Lanka Bureau of Foreign Employment via a short message indicating their interest to get a vaccine for foreign employment. At that point, registration was not mentioned at all, and the first vaccination was given, first dose was given. But come the second dose, about 1 week before the second dose, these people, potential migrant workers who got the first dose, got a second message from the SLBFE saying that you have to pay up and register with the Sri Lanka Bureau of Foreign Employment for you to get your second dose. So the concern raised by these people, potential migrant workers and interest groups, was that these are potential migrant workers. They are not sure whether they will really get the job or not. Normally, you get the job, and at the final stage only you do the registration. So given the financial difficulties that these potential migrant workers and the whole of the population in Sri Lanka was undergoing, whether it was fair to ask them to pay upfront for this registration fee so that they can get the vaccination second dose. But the Bureau argument was that this is not tied to your vaccination. If you're a potential migrant worker, if you're planning to go, you anyway have to register with the Bureau. So therefore, you better do it now. And then in future, you don't have to do it. So it's the same amount. So it was the timing and the way it was introduced, I think, was a sensitive issue. And some of these people didn't know that there will be a charge involved, and everybody with a vague idea of migrating for foreign employment also would have gone and got it. And now they were in a fix and they had to register to get their second dose. And having one dose, it was they didn't have an option. So that was kind of the catch in that. So perhaps this information should have been given at the first stage itself before the first vaccine was rolled out. So there were various ways of handling it. That's what happened, Ashani. Over to you.
Yeah, thank you, Dr. Bilesha. I think we have reached the end of our time for today's webinar. So I would like to end today's session thanking all the speakers as well as the audience for contributing to a very enriching discussion on the pressing socioeconomic issues facing Sri Lanka today and urgent policy measures which are required to successfully address these and move forward. Before winding up, I would like to remind you again to register for the third and final webinar, which is scheduled for tomorrow at 3 p.m. Details for registration are available on our website at www.ips.lk. Thank you again. I would like to thank everyone and wish you all a pleasant evening.
Thank you, Ashani.
Thank you very much.